Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology here in Portland, Oregon, coming to you with another segment. And as promised, I am here with my friend and colleague, Tomiko Saldia, and we're talking about pelvic floor physical therapy and chronic pain issues, and what Tomiko brings to the table with her expertise as far as helping you all achieve your best life. And Tomiko has mentioned before that she considers herself, and I do as well, I would second that, as an expert in treating chronic pain issues, with a subspecialty in pelvic floor physical therapy. And we've talked a lot offline about how chronic pain issues, not just in the pelvic floor, but everywhere in the body, is inhibitory, and things that patients can do to help treat those chronic pain issues. So would you care to elaborate on some of that?
So there are a lot of treatments that you obviously offer your patients regarding the symptoms they're having for urodynamic health. And for patients that come to physical therapy, I absolutely want to know what's going on with them in pain, since pain is definitely a disruptor to pelvic health function. And one of the things that we were going to talk about is yoga. So many people are interested in yoga. I've worked with lots of yoga students, and I have been a yoga student since 1999, so I have a lot of experience doing that. Then in 2010, I went and got my yoga certification, and the reason why I did that is because I had a lot of patients coming to me that were yoga students. It just was the weirdest thing. They were just kind of coming in by the droves, and I had yoga students and yoga instructors, and let me tell you, they were challenging people to work with, and that's mainly because people who do yoga are very passionate about yoga, and oftentimes if there's somebody that's struggling with chronic pain, it's hard to help them get out of pain because they do not want to stop doing movements that maybe are contributing to the pain responses in their body. So if I want to draw a direct link to physical therapy, one of the most important things that I like to tell people about yoga is that yoga is not rehabilitative. And I think a lot of people don't know that because they think if you're exercising, then that must be good for you. Mm-hmm. Or if you're stretching, then that must be good for you. And, as long as you're doing some kind of movement, then that should be good for you. And while that can be true in a general sense, it's actually not true when it comes to people who are dealing with persistent pain. So if someone is dealing with persistent pain, general exercises are not going to get them out of pain. Mm-hmm. And so what we do in the type of work that I'm trained in, which is mechanical diagnosis and therapy, it's also known as the McKenzie Method. And so one of the things that makes that type of treatment completely different than other types of physical therapy is that we have to do a movement assessment, determine the responses from movement assessment, and we can specifically understand where the source of pain is coming from based on how specific movements are impacting their pain. And so that is why we call it movement diagnosis. Some movements turn pain on and some movements turn pain off. And so if you're doing a bunch of movements over and over again, which yoga is that, it's, oftentimes we're going through these asanas and we're doing repeat movements over and over. And if those movements are movements that actually facilitate your pain, then you're probably never going to get out of pain. And I actually had an experience like that myself, where I was dealing with a chronic knee pain. And I slowly over time, I became more and more disabled because of the knee pain. And then eventually, I got to a point where I couldn't even go on a short hike, or even, I definitely couldn't run. And then I started getting to the point where even going on a longer walk was bothering me. So I realized that if I didn't stop doing that, then, I might eventually end up having surgery. And so what I learned from mechanical diagnosis and therapy is I diagnosed myself and realized that I didn't actually have a knee problem, but that I actually had a problem in my back. And I wasn't even experiencing any back pain at all. But after, spending plenty of time treating my back, the knee pain went away. And I think that's a very common thing. Oftentimes patients go to physical therapy, whether it's just regular outpatient physical therapy, or sports therapy, or pelvic health physical therapy. I think one of the things that is missing is the movement assessment that shows you where pain is actually coming from. And until somebody has a great handle on pain, they are not going to recover pelvic health function, at least from a physical therapy standpoint.
And I can tell you all, this is exactly what she has told me. I rely on my friend to give me her expertise, and same sort of situation. You, in fact, did movement testing with me and found out that I have a little bit of an atypical, not what the general population has. So my body requires very specific movements. The yoga activities that I was doing was actually causing me more discomfort, and even though it was in heat, I was doing heated yoga, and some of the other workouts that I was doing, boy, I thought I was building my body and my flexibility, and in fact, I had to change my body dynamics. I can still do yoga, so make no mistake, we're not certainly not saying that yoga is a bad thing at all. It's harnessing the understanding of what we can do and what we can't do that brings back good health to our bodies.
Right.
And once I harnessed that understanding, I'm now out of pain and I'm able to still do the activities that I want to do with some modifications. Just like in yang, there's an equal and opposite reaction. You can't have one without the other.
Right. So I'm going to share a really quick personal story, one that I have actually not shared publicly yet, but I have shared this with several patients just to really bring home the point how moving in the right direction is so important. If you have a cut right on your joint and you keep bending it, and let's say it's a bleeding cut, and if it's bleeding, you're probably not going to keep bending it. But that's often how pain is. Pain can be very much like a cut on your finger, and it's annoying. But what do? We splint it with a Band-Aid, and that Band-Aid is, it's snug enough to keep you from bending that finger again and again. And so that's how we heal chronic pain, is we determine where the symptoms are coming from, and it can be the cut, so to speak, and then we teach patients how to splint that area and avoid movements on those tissues so that we can stop the inflammatory process. And once we stop the inflammatory process, and we've done it for long enough, then we can stretch those tissues after that a period of time. Once the symptoms have stopped and the tissues have healed and the inflammation process has halted, then we can go back and recover function. So one of the things that's missing from physical therapy is that therapists love exercise, and they want to push patients into exercise sometimes too quickly, and sometimes more quickly than those tissues have actually had the chance to heal. So in my own experience, I was teaching Dr. Crites some exercises that she needed, but they were not exercises that I needed. And so that day, after showing her how to do them, I was standing in the kitchen and I was just cooking at the stove, and I suddenly got a spasm in my bladder. And then I had this gush of urine going down my left leg. And it was like, okay, well, that's nice. I'm glad I wasn't at work when that happened. But I actually don't have a diagnosis of incontinence. So it was very enlightening to have that personal experience, because it is exactly the same kind of idea that I am trying to convey to patients, that movement is very important. If you keep moving in the wrong direction, you will increase your symptoms, you will increase your pain, you will increase your ability to maybe sometimes recover. And sometimes you can do that to a point where you actually cause tissue failure and need some, more serious treatment or surgeries.
Well, and to that end, you text messaged me and we had a good laugh over the occurrence, because lots of times patients will come in and they will say, oh, well, my friend had exactly the same thing, and so my friend told me to do X, Y, and Z. And I always tell patients, do not compare yourself to your friends, because we are friends, and if we were comparing ourselves to one another, she is giving me instruction because I have a back condition to where I need to be doing movements that 99% of the population don't need. So I'm a little bit atypical. Same back pain, same perceived back pain, but clearly what she was telling me that I needed was not what she needed, and that was not what you needed. And that's where the good laugh, at least for me, came in, because you were trying something that clearly you didn't need, but I did. And that was the first response that you sent to me. I don't need to be doing what you're doing. It's worked beautifully for me, because that's my derangement. That's my body mechanics derangement. But it's very, very important for patients to not compare themselves to their friends, because what one person needs may very well not be what another person needs. And while friends are very well intentioned, they would never harm one another, at least we would hope. There's a lot of misinformation out there, so that's why it's very, very important to seek the advice of an expert and to be evaluated by an expert.
I agree.
Well, thank you again for being here today, and look at the bottom of your screen, everyone, because we will give you the information as to how you can reach Tomiko and reach out to her, and she can help you live your best life. And as always, hey, thanks for letting 360 Pelvic Health help restore your confidence.